third objective for this week is to talk about the typical positions within a healthcare information technology department. And there's really three levels of personnel in a IT department. It's really in any IT department, but specifically in healthcare IT, we're looking at clerical, professional, and technical personnel. The clerical personnel in a healthcare IT department provide administrative support, scheduling coordination, documentation and reporting requirements, whether it be for magnet status for nursing or for the Joint Commission or for any other reporting that they might have to the federal government, to CMS, as well as any privacy and security reporting. Typically, those are handled by, the reporting is actually handled by the administrative assistants. The next level of staff, if you will, is the professional staff. And those could be systems analysts or programmers. And the differences between those two, the systems analyst really is looking at a more holistic view of technology, and they're more the translators. So they're looking at what the end user's needs are, as well as the technical requirements or capabilities of the organization. And the programmers are that more technical software and maintenance type person. They may not have certainly the personnel skills, but also maybe the soft skills, but certainly not the clinical knowledge but they're very important and integral because of their specific knowledge base that's really geared around the technical aspects of the software. We also have technical staff that are operations driven. These technical managers have to maintain that computer and network environment and have a knowledge of the hardware and software requirements of the system. These operations-driven technical staff, the managers, also have to understand the physical responsibilities in a currency of technology to keep abreast of what's going on right now, and of course have those people skills because they're really concerned with the operations. Now keep in mind, like I said before, healthcare is a vertical like any other vertical that's out there. It's an organization like a bank or like any other institution that's out there, and there are operational needs. So these kinds of skills do transcend beyond just healthcare, but having that healthcare knowledge, that background, is really integral in understanding what your specific clients or end users are needing. We go into the IS operations supervisor. And those are the ones that really maintain that computer and network environment, and they have to have that knowledge of hardware and software with the responsibilities as well. Technical staff would include programming, system maintenance, network maintenance, data preparation, even medical equipment upkeep and repairs. The durable medical equipment on the floors like bladder scanners or IV pumps must be maintained, and typically they do have some sort of an interface to the electronic medical record. So they are providing patient data or data about therapies for patients and automatically populating the electronic medical record, thereby removing the clinician from that formula, so that it's another layer of veracity, of truth, where there's not the transcription error of a clinician or a non-clinician transcribing results from a device into an electronic medical record when you have that interface in place already. Some other positions, again, these are very typical of any IT department, but certainly in healthcare, end user support, help desk for the IT, help desk for the HIT. So you might have a help desk specifically for people that are having computer issues, but there also might be a help desk for people that are having issues with the electronic medical record or some of the clinical decision support systems. Software evaluation, perhaps software education. Certainly when we have these different medical records, or we have end users that have updates to they're either brand new coming into the facility, or an update has been applied to the EMR, then those need to be trained by people. So there are software education and EMR software education. And of course there's clinical strategists who are / translators. And those are the ones that are really looking out and going, okay, what do we need? What do our end users need? What do our patients need? And how are we going to bring those to light so that the people in IT are understanding what their end users are actually asking for. The next section of our requirements this week, of our objectives this week, are talking about the CIO priorities. And really the priorities and challenges for CIOs, even though they're on an annual basis, ongoing, there are some unique challenges. Now these, and it really varies depending upon who you talk to. Your CIO might have a little bit different priority or strategy for the upcoming year than other CIOs. But one of the things that we look at are surveys that are either put out by HIMSS or Gartner, or, for example, healthcare technology. So in this specific example, Gartner went ahead and put out a put out a survey, and CIOs responded and said that these were the major priorities for them for 2018. And they really synthesized them down into these 6 areas, which is to collaborate with CFOs, chief financial officers, and chief medical officers to align IT capabilities, along with implementing system-wide architecture to support their technology management. Of course, establish key performance indicators, because you can't really manage what you can't measure. Evaluate the value of existing technology and investments into those platforms. So what do we have? How well are they doing for us? And do we need to invest more? Or did we invest too much in them and we need to back off and invest in other areas? Developing new ways to assess those electronic health records, as well as mastering the soft skills. And those soft skills really have a lot to do with what I like to call transformational management. And what it is it's really kind of change management. Change is good, you go first. And you'll hear that again some of the time in the future. But how do we get people who may be reticent to change to more readily embrace the change and move forward with something that ultimately will improve economically as well as patient outcome and cares. So these soft skills are also a priority of CIOs. Another organization, Healthcare Informatics, shows their priorities a little bit different, and the way they and the way that they show those is basically in a percentage of what percentage of CIOs have determined that this is an issue. So, for example, 40% of CIOs that have been polled in 2018 said that deploying enterprise analytics was one of their priorities. 71% integrating with the EHR. As we move on to 2022 CIO priorities, we can see that data management and integration is still an issue and is number 1 on their list, along with a seamless billing process. We'll talk about billing as far as revenue cycle later on. Compliance. We're always looking for compliance. And of course, security and privacy is top of mind with cybersecurity, cyber attacks, business continuity, and we'll discuss that later in our course as well. The telehealth infrastructure. Again, looking for ways to make healthcare more affordable and more accessible, and moving on to equitable access so that we're able to provide healthcare to more people and more people who need it. So over the last 4 years between the 2018 survey and the 2022 survey, you can see that the CIO really does have a lot on their plate. Now, just a reminder, please review this lecture as well as the assigned resources and complete the assignments, discussions, and quizzes by the due date. I trust that this was a brief enough lecture for you. Again, go back and look at computer systems and network. That'll also be on the quiz. And thank you very much for listening.